evening. I am your host, Jennifer Jones. Welcome to Medical Mondays. Today's topic is updates on COVID-19. As Dr. O tag teams with Dr. David Ajibade, and she is going to come with us now to introduce their topic for the evening. Dr. O.
Thank you so much, and welcome to Medical Mondays. We're just going to take it from here. Or Jennifer, I'll give it back to you.
Absolutely. Thank you so much, Dr. O. Good evening and welcome to each of you for choosing to make health and wellness a priority for our community. Medical Mondays exist to provide information to empower you to be healthy by living a prevention-centric lifestyle. From choosing nutritious foods, sleeping, exercising, and taking care of your body and mind to have access to the highest quality healthcare practitioners, healthcare professionals, and health experts that all contribute to you living your best life. Thank you, audience, for joining Medical Mondays with Dr. Toyin Opesanmi, MD, and American Academy of HIV Medicine expert for an exciting conversation about our health. Medical Mondays introduces health information, medical facts, and possible solutions as we examine health challenges to enable each one of us to live our best life. Whether providing high quality care for families and individuals through Gennesaret Medical Center, providing care for vulnerable communities through Global Vision Health Center, or providing medical missions in the US or abroad, Dr. Opesanmi is committed to changing lives through healthcare wherever she goes, one person, one family, and one community at a time. Medical Mondays provides an opportunity to explore healthcare with one of our nation's leading community health advocates and world-renowned medical missions expert, Dr. O. Audience, if you have questions as you listen to Dr. O and our Medical Mondays guests, please drop them in the chat box or raise your hand and you'll be recognized to ask your questions. Now grab your pen and paper, lean in, and get ready for an exciting conversation about our health. Dr. O, the floor is yours.
Thank you so much again. Well, I will be dialoguing together with Dr. David Ajibade tonight on updates regarding COVID-19. As we know, just to refresh our memories, COVID-19 is coronavirus. And because we identified it in 2019, it's COVID-19 that we're dealing with presently. But before I go on, I just want to thank everybody that is here tonight. A lot of people are out of power in the state of Maryland. We have a storm, and I was talking to somebody on the phone, actually my accountant, and electricity went out. We also have a very key person who has never missed any of Medical Mondays, presently now in the emergency room. So much is going on, but for every single thing, we glorify God. I also want to say that we are not establishing care by the presentations we give here and the dialogue we have. This forum is about empowering you, strengthening you by giving you medical facts and giving you the opportunity to ask questions that we will answer as experts in the field free of charge. So, COVID-19, what a year and a half we have had. Coronavirus has been here forever. If you look at Dettol bottle, you will see that it says Dettol kills coronavirus. People from Nigeria look at the Dettol bottle. Some people call it Dettol, some say Dettol. It's been there because it's been there forever. But like every virus or any virus, it mutated. This was not the first time it mutated. It mutated, a few years ago in Asia. And at first, we called it SARS, severe acute respiratory syndrome, that occurred in Asia. And because it was in Asia, it was in here, I don't think we paid too much attention. Then we had the MERS, also in Asia. And because again, it was in a pandemic, we didn't give it much thought. Thank you for President Obama. He actually set up something in the White House to address possible epidemics and pandemics, but unfortunately, that was dismantled. Hopefully, the new, not hopefully, they're working on it now, and we have something in place, for future viruses. Coming back to coronavirus, it has devastated the whole world. A lot of people have died, the statistics. I'm not here to give you statistics tonight. I'm here to give you update. So, vaccines were produced in order to curb the virus. What do vaccines do? Vaccines emulate the virus in the body and cause the body to think that it's been exposed to the virus, and so produce antibodies, which are soldiers that protect and fight against the virus in the body. That's basically what vaccines do. The Pfizer and Moderna vaccine are the first mRNA vaccines we've ever had. And then we have the Johnson & Johnson, also, that is not mRNA, from DNA. But that being said, those are the three we have here in the US for now. And a lot of people have been immunized. As a result, we've had some stability. Yesterday, Maryland recorded 0 infections for the first time in this pandemic. And our governor in Maryland has decided that come July 1st, you can go out without mask, you can just start leaving. However, word of caution, we have the Delta virus, the Delta coronavirus from India. Not very long ago, we had 6% of people infected with coronavirus in the US having been infected with the Delta virus. It is extremely virulent, much more transmissible than the original virus we had, even more transmissible than the UK strain that has taken over the United States now. From the 6%, the statistics we had back on Saturday is that 9.9%, about 10% of people have been infected with the Delta virus. So we need to be careful. There's good news though. The mRNA vaccines we have right now, if you get one vaccine, one shot, the first one, it protects you 33% against the Delta virus. If you get the second vaccine, the second dose, it protects you 88%, which is great, but that's still 12% chance that you can still get the virus even after getting vaccinated. So we still need to be cautious. The places that have opened on July 1st, what do we do with it? When I said we should be cautious, but our governor, our leaders are saying that it's okay to now go out without mask and to start living. I think we'll discuss that further during the Q&A. There's something else, something brand new. The UK did a study The study is still very much hot, preprint right now. In fact, most, I would say maybe over 90% of the medical personnel, maybe more, don't even know about what I'm going to tell you. They did a study where about 394 people had MRI done pre-COVID, and a good percentage of those then got COVID. So they repeated the MRI on both sets. And guess what they found? That people who have had COVID lost in brain matter. And they compared those who had mild disease compared to those who needed hospitalization and were hospitalized, and found that there's no difference. There is still loss in brain matter. How significant that is, we don't know. This was supposed to be peer reviewed, but then we got Juneteenth. We got Juneteenth as a federal holiday. And so they had to postpone to this week. It's so urgent that they're doing the peer review right away. Again, we don't know the significance of this loss of brain matter. That has to be followed. So what am I trying to say? It's better to prevent getting coronavirus than to take a chance, because none of us know the full extent of this virus yet. And none of us know the full extent of the vaccine, the mRNA vaccine, because it's never been used, it's never been done. And if you're interested in me going in further into how it is done and all, we can do that in the Q&A. My message today is that we still need to be careful. And it's better not to contract the virus than to contract it. So I'm going to yield to Dr. Ajibade, because I don't want to take too much time. I just want to give you a quick update. And I want to give time for question and answers. Dr. David Ajibade.
Hello, Dr. O. Good evening, ma.
Good evening.
Thank you for having me. Good evening, everyone, and hope everybody's staying safe. Thank you for that introduction, Dr. O. Yes, about the great news about coronavirus, great news about the fact that it's been under control, especially in the United States and around the world. For sure, the mRNA virus and others like it have surely proven to be effective. So we're very grateful about that. Now, that is very scary about the gray matter loss in the brain. I've told people over and over again that this virus is a gangster. That's the only way to describe it, because of the kind of number of things that it does to the human body and how it affects the human body. So I'm just going to be saying a few things about the other things that you can do to keep yourself healthy. Yes, you get the vaccine, but understand that the vaccine is not the be-all, end-all of the situation. For instance, the vaccine is only specific towards the coronavirus. And yes, to some degree, it protects against the variants, as Dr. O has said. But we cannot leave it there. We cannot leave everything. And that's a mistake I see people making all the time. It's like, okay, we have a vaccine now, we can drop our guard and do whatever we want as long as we've taken the vaccine. That is not so. And I remember I was speaking in Nigeria at the National Broadcasting Commission, their annual event. And I said, this is not the first pandemic. It's not going to be the last pandemic. There will always be viruses. There will always be bacteria. And once in a while, a superbug is going to appear that's going to take all of us unawares. But in the final analysis, the one thing that you can do, and that's what the Medical Monday is about, is that you can do what it takes to strengthen your body, specifically your immune system. And we talk about this a lot In my opinion, this should be the foundation and the groundwork of everything that we do where our health is concerned, because your immune system is what protects you against all kinds of bugs and bacteria. But in addition to that, cancer, even cardiovascular disease, if your immune system is working well, cardiovascular disease too will be protected against. So I just want to say a few things, and then I'll yield to Dr. O, yield back to Dr. O. There are three, let me put it this way. I'm going to talk about the three nutrients that will strengthen your immune system. Notice I don't use the word boost, because boosting may not be in your best interest. And COVID-19 has taught us this. Many cases in which COVID-19 was so severe in patients, and that even caused death, it was because the immune system was overreacting. It was not just the virus that was causing the damage, it was what the virus triggered in the immune system. So the immune system went haywire and started attacking the blood vessels, the kidneys, the heart, and yes, even the brain. And that's where the challenge was. So you don't necessarily want to boost your immune system, but you want to strengthen your immune system. So your immune system will be intelligent enough to take charge and reduce and not go overboard when it's trying to protect itself. So I'm going to leave you with three main nutrients, which we have heard about over and over again, but we cannot overemphasize them. One is vitamin C. The thing about vitamin C is that vitamin C helps to protect the mucous layers, which are in the nose, the mouth, and other parts of the body. That is your first barrier and defense against infection. Vitamin C also stimulates the immune system and helps the immune system to mount guard and to fight off infections. Vitamin C does a lot of other things as well, but I'll stop at that. Vitamin D2 is super important in many of the cases, or if not most of the cases, and by that I mean 95 to 98% of the cases of severe COVID-19, they found those people to be very deficient in vitamin D. Vitamin D, what vitamin D does is that it helps to modulate and temper the immune system so that the immune system doesn't go haywire, as we had earlier said. And number three is zinc. Zinc is very important in that it helps to stop the replication of the virus. There was a lot of shout about hydroxyurea, and there was a lot of controversy. I'm not going to wade into that, but not hydroxyurea, I'm thinking about sickle cell disease. I meant hydroxychloroquine. What hydroxychloroquine does is that it opens the door for the zinc to enter into the cell and to kill the virus or to stop the replication of the virus. It is not the hydroxychloroquine that's actually doing the work, it's the zinc that's doing the work. So you need those three. Now, in addition to that, and I may have mentioned this the first time I spoke, in addition to that, remember that 70 to 80% of your immune system rests in your digestive system, in your gut, in your colon especially. Therefore, it means that the health of your digestive system is absolutely key to the health of your immune system. What does that mean? It means you cannot be putting junk in your body and be thinking that your immune system is going to work like it should. Because 80% of your immune system is in your body, is in your gut, in your digestive system. So it's very important that you still stay primed, you still stay on guard, you still take your healthy stuff, the fruits and vegetables, dial back on the alcohol, dial back on the smoking, dial back on the excessive junk food and the preservatives and all the other processed foods that you've been warned about. You know better. So you want to dial back on those things because those things specifically affect your guts and they affect your gut adversely. In addition, you need to take a lot of fiber because the fiber feeds the good bacteria, which in turn help to feed the immune system. One more thing I'll say before I hand back to Dr. O, your dentition, your teeth. Your teeth. I love Dr. O's, look at Dr. O's dentition. Look at how white and fresh, and this. It's the same thing with Jennifer Jones. I'm Dr. Jennifer. You guys also all have beautiful teeth. Please, it's so important. There's a lot of data coming out now about the importance, the relationship between the health of your teeth and your gums and your immune system and your cardiovascular system. A lot. So you want to make sure that you're flossing regularly, you're brushing your teeth before you go to bed. And of course, as they recommend, 6 to 12 months, the standard is 6 months, you go and do your medical checkup, your dental checkup. In Nigeria and other parts of the country, parts of the world, they may not be able to do that, but in the US, you have better access to that. So please take advantage of those things. They are super important. They may not seem so, but they are super important. Thank you, Dr. O. Let me hand it back over to you.
Thank you very much, Dr. Ajibade. That was awesome. You know, this forum is all about prevention. You guys who were here from the first episode, remember me saying that we do better preventing in medicine today than treating. We prevent so many things, or we can potentially prevent so many things, but then it takes partnership between physicians and patients. We have to do a lot to protect ourselves, to prevent illnesses, and coronavirus is one of them. We really can do better with our immune systems, like Dr. Ajibade said. And I just want to add that vitamin D actually has been shown to help block the virus. So vitamin D with zinc, our pulmonologists, advocated that and still advocated that we should add that to vitamin C. And if you are not sleeping well, melatonin also, we should add melatonin to the regimen and aspirin.
Dr. O and Dr. Ajibade, I want to commend both of you on an absolutely exceptional update. I placed in the chat box what I think I heard, and I'm going to have us continue to repeat it despite the fact that we are vaccinated and the emergency orders are being lifted. We need to still proceed as if the virus is a threat. Continue social distancing, continue wearing our masks, continue drinking water, continue eating healthy, continue being vigilant, is what I think I heard you say, Dr. O. The brain matter issue is frightening. We're waiting for the results and outcomes, but is that what I heard you say, Dr. O? Stay vigilant.
That is correct. Stay vigilant. No matter what your state dictates, no matter what CDC even says. On that point, I want to note that a lot of people have been upset about CDC saying that, they said that you should wear one mask, then they said 2 masks, and then they come up with this suggestion this week, and next week they change. CDC has been doing awesomely well. Medicine changes. We change as we learn more. We change as we research and results come in. And CDC has been on top of this. Researching, implementing, putting different things in place so that we can learn more about this virus, and immediately educating us as, citizens so that we can benefit from protection. We've got to remember that God gives us knowledge in minuscule forms, and we utilize what we have. You cannot give what you don't have. The only thing that does not change is the word of God. The Bible does not change. It's alive. It breathes, it lives, but science changes. What I'm telling you today, come next month, I may come again with another COVID-19 update. Guess what? This brain matter issue, I'm going to come back to update you. We don't even know much about it yet. We don't know what the significance is of this loss. So we're going to keep updating as we learn. And so for people who have been discouraged about the changes and regulations and all, it is for our own good. Those changes are brought as more knowledge is bestowed.
Beautifully said, Dr. O. Dr. Maya Angelou has a famous quote that she says, when you know better, you do better. And so that's what you're saying. When we know better, you will
We
come back
do
and
better.
update
That's
us.
right.
Yes, Auntie. And you know, I know you. You make sure that we know better. She's a woman who makes sure in anything she touches that you know better so you can do better.
Absolutely. And Dr. Ajibade, you did an excellent job. And we have a couple of questions in the chat for both of you. You did an excellent job of sharing with us and reminding us how important our gut, what we put into our bodies, what we eat, what we drink, and even for the smokers, we need to stop all behavior that really puts at risk our best chance to fight against the virus. Dr. O and you both have shared that coronavirus is with us and future virus and pandemics may be before us. And so the best thing that we can do is first go for vitamin C, D, zinc, and Dr. O added melatonin to complement you if you're not getting enough sleep and rest and restoration. So with knowing that and with healthy eating, Dr. Ajibade, what do you want people? Everyone is concerned in the chat about finding the right vitamin C, the right vitamin D, where they can find it. Someone even said that at Costco, they've been told that the vitamin D that's sold on the shelf at Costco is not good. Someone else has raised the issue of too much vitamin D is toxic. So what dose should they be taking? And others have asked, is there an equivalent in taking vaccine versus prophylaxis? So let's just deal with the vitamin D and zinc first, and the vitamin C. What doses should people be looking towards?
Great question. I generally recommend, unless you are out in the sun every day for about an hour at the very least, if you're dark like I am, maybe not as, even if you're light the way Dr. Jennifer is, I would strongly recommend that you take nothing less than 5,000 international units a day. Let me tell you this, folks, the risk of toxicity of vitamin D3 now, if you take D2 on your own, D3 is the more important one and it's a healthier one. The risk of toxicity of D3 is really, really low. I mean, you would have to take you would have to be taking like, what they say is like 60,000 international units a day for a long period of time for you to really be toxic. And I believe the upper limit is about 150 nanograms per mil, nanograms per mil. That's when you're talking about toxicity. Now, the average they recommend you should be, the safe zone is between 30 and 100, 30 nanograms per mil to about 100, but it can go as high as 150 without any adverse effects. So I would rather have too much vitamin D and get COVID-19 than too little vitamin D and get COVID-19. I mean, it just makes sense that you don't want to be caught with your, as they say, pants down. Forgive my French, but you don't want that. You want to have enough vitamin D, especially as a Black person. I cannot overemphasize that. Black people have low vitamin D. In every test, they have seen that Black people have relatively lower vitamin D levels because of our dark skin. So it's very important. Now, in terms of what specific supplements to use, we cannot give you specific names because of the platform, unless, of course, we're given permission. But you can contact us afterwards, and then we can definitely point you in the right direction. There are some, as in all cases, there are the good, the bad, and the ugly out there. So you want to be pointed to the right ones. What was the other question you had, Dr. Jones?
And so the next question was, someone asked about, go right ahead. Absolutely, Dr. O, because I thought you would want to talk about the vitamin D.
Yes, thank you. I appreciate that. So Dr. Ajibade is correct. However, in the United States, we have the opportunity to test and we have access to excellent health. Excellent health facilities, healthcare facilities. Vitamin D is one of the fat-soluble vitamins. See, as opposed to vitamin C, that is water soluble. You can take as much as you want of vitamin C and you will urinate it out. You pee it out. Vitamin D, on the other hand, A, D, E, K. Those 4 vitamins are fat soluble. So the potential for toxicity is there. So in the United States, we actually monitor every 3 months. When we put you on vitamin D, we monitor you. I, in my practice, actually screen for vitamin D deficiency. And once I screen, if you're deficient, I will start you on a dose with relation to your deficiency and then continue to follow. So while, I agree with Dr. Ajibade, I am a little bit leery about the sun too. Look at how dark I am. Do you know I got sunburnt one time in my life and I was over 50 when this happened. I got sunburned in Phuket, Thailand. I had a blast with my husband in the sun every day, no sunscreen, sometimes just had a wrap around me, tied on the shoulder, was at the beach, or at the pool every day. And I got back and I was peeling in my face. I actually got sunburned, my shoulders and all. So I called my friends and I'm like, wait a minute, I'm Black. How did I get sunburned? They all started laughing at me. These are all physicians, and said, don't you know that even as a Black person, you need to wear sunscreen? That you can get sunburned? I said, I lived in Nigeria, I never got sunburned. I played netball. I was a relay race runner. I did 100-yard dash. I was in the sun all the time. I never got burnt. That being said, we are dark skinned because of melanin in our bodies. The melanin protects and shields us from the sun. So I see people from Africa who are vitamin D deficient, and it blows my mind that why? Because it's very hot there. The Lord gave us this beautiful skin that don't wrinkle. So you're 100 years old and you look like you are 60 something because of melanin. So we are shielded. We're protected from getting skin cancers as much as our Caucasian counterparts. So as we advocate that Caucasians should put on sunscreen, we're now advocating that African Americans, Black people, generally should put on sunscreen. And that shields you from vitamin D. My suggestion, take the supplement. There are foods though that are rich in vitamin D. Mackerel, tuna, salmon. How much should you eat to get enough? How much would you eat to get enough? Maybe truckloads, I don't know. But I don't know anybody who has been able to bring up their vitamin D level through diet, through food. Please, if you know, let me know. I'd like to know. So taking vitamin D is very important. And if you're in the US, work with your physician to do that.
Thank you so much, Dr. O. One of the follow-up questions while we have you, Dr. O, and then I'll come back regarding the vaccine for both of you, was with what is melatonin, and can melatonin be taken in combination with unison sleeping tablets?
Excellent question. Melatonin is a natural product in the body that causes us to sleep. The reason we sleep at all is because we have melatonin in our system. So it's over the counter, formulated into pill form. It would have, other things in there to make it into the pill form. What's the other question?
The follow-up to that was, can you combine melatonin with Unison? And it sounds to me like if you're taking melatonin, you might not need Unison.
Thank you. Thank you. You answered the question. If you're taking melatonin, you may not need Unison. I will not combine them. I'll say try melatonin. Try starting at 5 milligrams, you can go up to 20 milligrams. The max dose is 20 milligrams, and see what works for you. Some people start with 3 milligrams and say, oh, I can't sleep, it's not working. Increase the dose. You can start at 3 milligrams too, then increase the dose to see what dose works for you.
That's beautiful, Dr. O and Dr. Ajibade, because I can tell you, when I was caring for my mother a few years ago, when she was recovering from a stroke, and she recovered, she's fit and thin and thriving, and her vitamin D pill, now she's 90 now, but her vitamin D was 50 milligrams a month. They gave her 1 tablet every month. And so I appreciate you so much for underscoring that it would take for you to be taking enormously high amounts of vitamin D to move into some toxicity or risk. And that vitamin C will be eliminated from our body. So there's no risk in taking those 2 vitamins. There's another question regarding the vaccine. Someone wants to know if these prophylaxis for vitamin C, D, zinc, and melatonin should be considered, or what's the equivalent between them and actually getting vaccinated. And then if you're vaccinated, does it prevent you from death?
Okay, I believe, first of all, the recommendations on what we've talked about, the vitamin C, D, and zinc, is to boost the immune system, as Dr. Ajibade, beautifully educated us on. Not boost, to, he corrected us, he said, don't boost your immune system, but it's to strengthen, correct?
Yes.
Your immune system. So we need a robust immune system to fight any infection, including coronavirus. So that's the purpose of those supplements. The vaccine, we know, protects against coronavirus 90% of the time, at least for Moderna and Pfizer, 94%, I think, for Moderna, actually. And J&J a little bit, less. That number varies. I think 70 something in the US. But the vaccines are protective. If you get the vaccine and you contract coronavirus, which is still possible, remember, none of these vaccines are 100% protective. So you still have that, percentage of time that one can contract coronavirus. If you do, can you die from coronavirus? Well, that's a difficult one to answer. I would answer it that you definitely will not get as sick as you would have been if you didn't have the vaccine, because hopefully you have some antibodies against coronavirus. The reason why I cannot answer that question directly is because in the US, we give vaccines, but we don't check to see if you actually develop antibodies or enough antibodies to say you are totally immune. My husband got coronavirus vaccine in the UAE, and there they actually test to see if your body mounted enough immunity. And after his second dose, 2 weeks after, it was found that he didn't mount enough immunity, or immunity as they expected. So they gave him a 3rd dose to make sure that it does. We don't do that. So is it possible that people who get the vaccine in the US and end up still getting coronavirus fall into the category of people like my husband, who after the 2nd dose didn't actually mount enough antibodies to protect him? And so they were able to contract coronavirus. Is that possible? Yes, it's a possibility, because we are not testing to see if people actually have antibodies, or how much they have, or if they have enough. Is it possible that Somebody may contract the Delta virus, for instance, and still have that high risk of dying from coronavirus. It is possible. It's a difficult one. What I will suggest is that we look at ourselves, and if we have any of the comorbidities, that is, any of these other things that I'll mention that can cause somebody to actually die if they get coronavirus, then we need to work on those as preventive measures. Obesity is one. Smoking, diabetes, high blood pressure. I mean, controlling these things. If you have them, you have to control them. The diabetes, high blood pressure. You know, people who have cancer on chemo. Look, if you have to be in your house and don't go out and be a hermit, be that until we get a good handle of this and not get exposed. So if you have any disease entities that affects the immune system, then protect yourself. So you're not in areas where you can expose yourself to coronavirus, even after getting vaccinated. That's an excellent question.
Thank you, Dr. O and Dr. Ajibade. I have two quick questions that I want to make sure we talk about in this update. One is there are a number of people seem to be experiencing mental health anxiety and other challenges now that COVID is quote unquote over. And equally, people are starting to experience what seems kind of like a post-traumatic experience about going back out and being in society. And coupled with that is the concern that parents are having for their children as we look to the fall for them to return to school and for the college students to go back into the classroom. What are your thoughts about these mental health anxieties and grave concerns that so many are having?
Dr. Ajibade.
Okay. I wasn't sure if you wanted to go first, Dr. O. Yes, those are big problems. And as a matter of fact, I think the statistics are scary. 30% and above, they're saying have some kind of mental health challenge amongst those who have actually had the COVID-19. Some of them, they call them the long haulers. Terms like brain fog are beginning to show up in many clinics of patients who maybe they just had a mild COVID-19 attack. Maybe the loss of smell, a little malaise, fatigue, fever, and they were okay. And then weeks afterwards, you would see them come back to the clinic with some terrible symptoms, including severe fatigue, sensitivity, numbness, brain fog, inability to remember words and names. I mean, it is just ridiculous what we're hearing about. And of course, Dr. O mentioned the loss of gray matter. So we are dealing with, this is really uncharted territory, not to mention the high rates of anxiety and depression and PTSD and all those things. So in such conditions, and this is where not just the healthcare professionals need to be equipped, but also the general public. So there are, and the way I think about it is what is it going to take to strengthen the brain? We talked about the immune system. I think we also need to start thinking about strengthening the brain. There are now nutrients, scientifically proven nutrients and nutraceuticals designed by well-respected scientists and doctors that are targeting brain function and brain structure that will help to strengthen the brain. A typical example, of course, are the omega-3 fatty acids. And I have to say this, that 90% of the omega-3 fatty acids, with all due respect, in health food stores are not up to snuff because there's a lot involved in purifying omega-3 fatty acids and making them bioavailable for the body. So there are some really good ones that will help. And don't forget, 60% of your brain is actually made up of fat. And that fat, a large percentage of that fat is made up of omega-3. So if you are strengthening your brain, you cannot not talk about strengthening using omega-3s. Obviously, there are habits, and I'm going to say talk about a few more nutrients, but there are habits and practices that are very important. Dr. O mentioned the Bible, your religion, depending on your religion, your religious practices, spending more time in things like meditation, things like silent repose, contemplation. These are things that help to calm your brain down and help to strengthen that inner man, so to speak, that inner part of your who you are, which in turn helps to strengthen your brain. Exercise, of course, is very important. Sleep. The reason we didn't say this, Doctor, but the reason why sleep is so important is that sleep is when your brain and the rest of your body get the chance to repair themselves. So the deeper your sleep is, the more restful your sleep is, and the more qualitative your sleep is, the greater the chance you have of recovering. And I still want to emphasize again that fiber, please, fiber. Now there are good quality fiber supplements. I take one almost every day. The flakes, not the tablets, not the powder, but the flakes. And you're all familiar with the one that starts with M that is in most stores. I don't even recommend that. There are more natural, more organic forms of fiber supplements that will do extremely well, especially if you take them at night, in helping to heal your digestive system and helping even to help in brain function and improving your brain structure as well. So fiber, you cannot overstate the importance of fiber. I know I'm throwing a lot of things out at you, but please, the antidote to depression and anxiety, in addition to going to a counselor, is rebuilding your brain and giving your brain the right nutrients. I'll stop at this point so Dr. O can say a few things.
That was absolutely beautiful. And you're not throwing too much at us. I'm trying to recap some things in the chat box, but this is excellent. This is exactly what we needed. Dr. O?
I 100% agree. Dr. Ajibade has answered that question very, very beautifully. But if you will please put your contact in the chat box, that would be great, so that people can contact you on these supplements and all of that. I just want to say that strengthening the immune system overall is very important, and sleep is very important. In fact, Dr. Ajibade is working on sickle cell disease, utilizing the immune system to prevent crisis and deaths in sickle cell patients. Can you believe it? A genetic problem. So our immune system is very, very important. If, for instance, if you have somebody with sickle cell and all, please contact him. Put your contact, please, in the chat box so that people can easily contact you.
Dr. O, we are going to now ask you for your medical moments. Right after we hear from Dr. Ajibade, any closing comments that he has for our audience.
Thank you, Dr. Jones. Your health is in your hands. Please take responsibility, take control of your health. We shall all get through this and we shall be stronger at the other end. So stay safe. God bless. Thank you.
Thank you so much, Dr. Ajibade. Dr. O?
Prevention, prevention, prevention. Strong health, strong future. And please stay put as we go into the after hour. And there's still so much I want to talk to you about. Thank you.
Thank you so much. Thank you, Dr. O. Thank you, Dr. Ajibade, and thank you to each one of you, tonight's participants. As we continue our mission to educate, inspire, and empower you and give you medical information and more that includes fitness, nutrition, health, wellness, lifestyle boosts, and as you've heard, joy, peace, meditation, recommendations for your soul. Please share the Medical Mondays link and invite your friends, family, faith-based organizations, nonprofit organizations, and community groups to join us, as well as individuals that you meet. Email us if you have any questions or need additional information at medicalmondaysdro@gmail.com. That's medicalmondaysdro@gmail.com. In addition, please subscribe to our Medical Mondays channel on YouTube and be sure to hit the notification bell on the page. You'll be notified for future shows and can join us with one click of a button. And most importantly, as Dr. O just said, strong health, strong future is our mantra. So hashtag it, strong health, strong future on social media. Share the link on Twitter, Facebook, Instagram, and TikTok. We look forward to our next conversation with you on Medical Mondays at 7 p.m. This concludes tonight's edition of Medical Mondays. Thank you and good night. Okay, everybody, stay on the show. Don't leave us. We have so much more to talk about. We are just excited about this mission that we are on. We get feedback from elected leaders. We get feedback from community leaders. We get feedback from everyday individuals saying how much something they heard or learned on Medical Mondays has blessed them. I myself can tell you, I am so much more focused on getting good sleep and continuing to eat well and getting my exercise up, my walks up, my numbers up, because I want to live my best life for as long as God gives me breath. So Dr. O and Dr. Ajibade, please continue the conversation. And Dr. O, I have to ask, do we have a Medical Mondays winner this week?
Yes, we do. But before we go to the Medical Mondays winner, I'm so excited.
Yes.
I have to just mention some people on this forum. I'm going to let Dr. Jennifer talk about Medical Mondays champions and why we give gifts and who we give gifts to. But we actually gave gifts to a Nigerian participants who have participated with us from the beginning. We sent them to their bank accounts some tangible amount of Naira. So we did that. Tonight, though, we have somebody from Ghana. You know, we have people from Canada, from Liberia, from Nigeria. And tonight we have someone from Ghana. So if you please unmute yourself, Ms. Janet Mensah from Ghana. Mind you, it's 5-6 hours ahead in time for all of our African participants, sometimes longer when people from Ethiopia and all join. Ms. Janet Mensah, are you there? Can you unmute and say hello?
Hello to everyone.
Hi, welcome. All the way from Ghana.
Yes, please. I was
so
invited by Pastor and Hannah and Pastor Ephraim. Thanks to be part of this great family. I'm blessed. Thank you.
Thank you so much.
How do we say welcome in Ghana? How can we welcome her in Ghana language?
Yes, please.
Please.
Anna.
Aquaba.
Aquaba.
Yes, please.
Aquaba.
Thank you.
Thank
Was
you.
that borrowed from Yoruba? Ekabo.
No, please.
Hello, please, did Dr. Evie get a chance to say anything yet?
Sorry?
Dr. Evie Okundaye? She's on board.
I know.
Okay.
So
okay,
thank you so much for participating tonight. We really appreciate you.
And Dr. O, this is an excellent, Dr. O, this is an excellent time for us to put our screens on gallery view to celebrate all of our international participants. So I'm gonna put us on gallery view and ask, okay, go ahead, go ahead.
Go ahead, we can do that.
No,
because we have
no.
some more people to celebrate.
So celebrate them all, then we'll do it at the end.
Then we'll do it together.
Yes,
thank you.
Yes.
So we have the president of NAPAC California on, Dr. V. Dr. V, can you please unmute? Show your face, please. It's so nice to have you. Dr. Veronica Ufogbuna.
Ofuegbuna. Yeah, that's my chair.
Kindly unmute. Dr. V.
Maybe she left.
No, she's here.
She's there. She just needs to unmute.
Yes, okay. I'm going to ask her to unmute. Maybe.
Yeah, I was gonna send and try to see if I can get her.
Dr. V, can you unmute, please?
Yes, okay, hi. Sorry about that. Anyway, yeah, I'm here. Hi.
Okay, welcome. And
Thank you.
what? Dr. V did not come alone. She invited Dr. this is
Ivie. Ivie Okundaye.
Ogundaye.
Yeah.
Dr. Ogundaye.
I know she logged on and then I'm trying to
I
find her.
saw her, yes.
I saw her too, so.
A proper welcome.
She was here. She was here.
She was here.
I don't know, maybe.
Yeah, I wonder if her connection.
You know what? Can you get her back on? Because we.
Okay, hold on. Let me get her. Let me find her. Yeah, hold on.
Get her on. We would appreciate her.
Yes,
So over to you. And you know what? We have Madam VP, who we know she's here from the beginning of our program. She's always been on. Madam VP from California. Please show your face, ma.
Yeah, I'm driving.
Hi, Madam VP. You rock. Please, can you come back? They were looking for you now. They said I should call you. You mind coming back just to say hi?
Okay, you're right. Okay, sorry. Okay, I'll be right back.
Okay,
So
thanks.
we also have Mr. Taye Dogati, all from California. These are Californians tonight. And, please unmute. Don't just wait.
Yeah, just hold on. Sorry.
Hello, everyone.
This is not his first time here, but thank you, sir. Welcome.
Hi.
Sir. Happy to be here.
Thank you. And also, Attorney Ademola Okusonya. He's here. Unmute, sir. He invited so many people last week when he heard the topic. And, I wanted to, acknowledge him, but, things took a different shape. So I'm so glad that we have the opportunity tonight. All our Marylanders, we are not discounting you. Another attorney, Opaleye from New Jersey is on. He's always on. He's been always on from the beginning. There he goes. Attorney Opaleye. Miss Anbelo, I see you. Jennifer, I think we should appreciate everybody. I'm handing over to you.
Thank you all so much for joining us. You don't know how genuine, how pure, and how sincere Medical Mondays is as a conceptual. It is not me, it's not Dr. O, it's not Dr. Caprice. It was truly God inspired. And so we have made some simple guidelines that Medical Monday will be accessible to all. The YouTube channel means that you'll be able to go back and share other shows with individuals. And most importantly, that we become a family, that we try to do our best to use this platform to share the highest quality medical expertise, medical information, inspiration, education, and motivation. So you all are helping us to expand our tent and spread the word so that we can say Medical Mondays is an international show and that we have participants from across the country and globe. So thank you all so much. I am going to put us on gallery view and ask all those who will to please unmute your mics, please. Let us see your faces and give a hello, a welcome, and a thank you to each one of us for joining this show.
And Dr. Ivy
Ivie, okay, good.
Is here.
Yes, hi, good evening, everyone. How is it? Actually, I have my husband here
Yes, please. Greet us.
Hi.
So
Hi, my husband.
we'll be right there.
Hi,
We'll be right there.
Veronica,
I just wanted to say, I just wanted to say, Dr. Veronica is a mentor of mine, and really I consider her, of course, an auntie, a second mother. She's really been so instrumental. So thank you for inviting me to this group. I apologize for coming in and out quickly. You know, I was doing some other stuff, trying to organize myself, but I just wanted to introduce myself. Can I say a little bit about myself? Is that okay?
Yes, please. And you know what? We would like it. Hi, hubby.
Hello. Hi, hubby. We're glad to see your face behind the person that has this beautiful, brilliant wife. Thank you.
You're so smart.
Thank you so much for your support.
So
you know what? We would like to have her sometime on Medical Mondays.
Oh,
so go ahead. Tell us about yourself.
Yeah. And so real quickly, Israel is a Nigerian American, proudly Deltan, which we are, and Lagosians. And then the husband is Ghanaian American. So I just want to make that connection. I heard a few Mensas here and there. So I want to make that connection. Yay.
Fantastic. And you know what? By the way, I am going to Ghana.
Oh, you are?
So you need to talk to Dr. Evie and Mr. Aqua.
You know, he's also a doctor. So my background, I'm in internal medicine and nephrology. So I just finished my postdoctoral fellowship at Stanford. So my area of interest is women's health and trying to improve outcomes for fertility, contraception, and pregnancy among women who have chronic kidney disease. So I just submitted a manuscript last week to American Journal of Kidney Diseases. So we'll see. And I'm working on other projects. You know, my wonderful husband is also a doctor. He actually is in oral and maxillofacial surgery residency. So as you know, originally from Ghana, and then had to do some additional training when he came to US, repeat some of his training. So now he's finishing up one more year left of oral and maxillofacial surgery at St. Joseph's Hospital in New Jersey. And down the road has ambitions for cosmetic work and plastic surgery. Yeah, so we would love to be, my husband and I would love to be a resource for this community, especially for our Nigerian, mentors and, people we look up to. So thank you for the invitation.
Thank you so much. We got two speakers. You got to speak. So I'll be contacting you. Please private chat me.
Okay.
With your information. And this is not just Nigerians here. We have Nigerians, Ghanaians. Many of our movers and shakers on this platform are Ghanaians. They're my brothers and sisters. And I mean that, seriously. And, I have children there too. Hannah, Ephraim, Manasseh, Cindy, and, we have Miss Janet Mensah, all the way from Ghana today.
Wow.
Yes, she zoomed in from Ghana. And there are more.
Dr. Caprice.
And, okay, Dr. Caprice's husband is the one we are going with to Ghana in December for medical missions. She's my brother. And all he had to say is medical missions. I'm like, I'm coming. He didn't even invite me. I said, I'm coming and I'm going.
Wow.
So we have a lot of Ghanaians on this platform that are part of this platform. So welcome home. You home.
Thank you.
And I'm also on social media. I'll put all my contact information, but I'm on Instagram at Dr. EVAOA. I have a YouTube channel to encourage, health information for Black people, especially Black women as well. So yeah, I'm here. Coronavirus update. Top question.
Oh, I see your YouTube contact.
Yes. And then I'll put my social media as well.
Okay.
Just a quick rundown of Ghanaians. We have Gladys here, we have Mavis there, we have Alberta, we have VC.
This is all.
Who else do I see now? Trying to run real quick on the Ghanaian. We have Josephine.
Wonderful.
Family. The BJs are there. All right, it's a few I can mention for now. God bless you all. We love you so much.
Mami Alberta.
Mama
Mama
Alberta.
Alberta.
Yeah, I mentioned that already. And BC.
Okay, so
Very nice.
we'll have to connect. I don't know, on
Yeah.
their news platform. Or,
Right.
Yeah, right here, connecting here every Monday morning, every Monday at 7 p.m.
Okay, got it.
That's
Yeah.
right. So if you please private chat me with your phone number,
Okay.
I will connect you also to Ephraim. We just talked. We have a huge Ghanaian society, community here.
Okay.
Wow.
Wow.
I didn't know that.
Yay.
Thank
So,
you so much. It
over to
is
you,
so
Jessica.
wonderful and so excited. Now, if everyone can unmute your mic, show us your picture. We want to see your face and give a round of applause to Dr. O and Dr. Ajibade for such an amazing update on COVID-19 and to celebrate all of our guests, especially our California crowd, our Ghanaian crowd, and our new young health professionals. Thank you so much for all that you are doing. We are going to continue. If there are any other questions and answers, I do want to share with you just two quick things on Dr. O. I think I see Dr. Ajibade logged in. So if you want to connect with him, he may want to have some comments before we go. But what I wanted to share was VIPs and champions. So on our Medical Mondays, for anyone who invites between 10 and 25 guests, you qualify to be one of our Medical Mondays VIPs. And for those who are able to bring 25 or more guests, you qualify to be our Medical Mondays champions. We've also made some of our great clinicians and health providers like Dr. Ajibade our VIP Emeritus Medical Mondays champions, because they are committed to not just coming once or twice, but to absolutely being a part. And Dr. Ajibade is our Medical Mondays champion winner because he had over 50 guests on one show. I think he invited 75 or 100 guests, and 50 were able to join us from all over the world. So I encourage you to use this platform to open up the opportunity to be heard every Monday at 7:00 p.m. Eastern Standard Time. And we welcome you to be Medical Mondays champions and VIPs. Tonight's gift goes to our beautiful sister all the way from Ghana. Oh, go right ahead. Go ahead, Toyin.
No, it's all right. Yes, go ahead. Go ahead.
From Ghana, and we are going to find a way, whether we send an Amazon gift card or we provide you with some money in your account. We're going to find the best way. As Toyin said, we will get some cash to you. In addition, Toyin, do you have another guest for tonight?
Yes.
Thank you so much. God bless you.
You're so welcome, Miss Janet Mensah. Thank you.
Cindy and Manasseh invited 10 people last week.
Beautiful. Are they on tonight, Dr. O?
Cindy, Manasseh, I don't know. I'm looking for them.
Abija family.
Abija family.
Abija family, are you on, and can you unmute and let us see your face so that we can celebrate you?
They are on.
I see them. I see them.
We are on. We're on.
Congratulations on being Medical Mondays VIPs. We are so excited to have you be VIPs for this week, for inviting guests and sharing the good news that happens here on Medical Mondays. The gift that we have for you this week is for your very own custom order of Mo Berry's strawberries. And so I'm putting information in the chat box. Please reach out to us so that we can have your contact information. You can DM Dr. O, me, Ephraim, and Hannah, our Dynasty team. And Dr. Caprice is on travel this week. We wanted her to enjoy her vacation. We're so excited that she's able to get some rest and renewal. And so she wanted us to be sure to tell you Mariah Benjamin is going to be providing the gifts. I put the contact information in the box. Just DM us your information so that we can celebrate you and get this order to you. If our guests can one more time unmute yourselves and just give a round of applause to our winners this week, we'd be so appreciative. And please, if you want to give some comment, please do so.
Yeah, you can just raise your hand and talk if you'd like to say something. Did we answer all the questions?
I think that we did, Dr. O. I'm just going to check here if there's anyone that has a comment or question.
Is there a website? Is there a website for this particular group so that what you cover, we can just go there and follow up? Do you send a video of the session so we can, you know, broadcast it, kind of a thing? Yeah.
Yes, Dr. Veronica, we have a YouTube channel and I will try to pull it and drop it in the box.
All right.
And our website will be coming up soon.
Yes.
And
Dr. Evie is like my daughter. So I'm talking like a mom now. She has a YouTube channel. Is there a way to blend that into your website, or maybe she can talk with Dr. O or you further?
Yes.
She has amazing topics throughout the coronavirus, and she is a United Nations awardee, because I'm very active in the United Nations. So I think that she'll be a really good young doctor that has this amazing vision. And United Nations is actually recognizing her during the month of October. So maybe, oh my gosh, my mouth.
That is fantastic.
So she is amazing, amazing.
Well,
thank you, Dr.
Jones.
We are absolutely in partnership. Every single physician that is a part of this Medical Mondays family, the things that we have planned for Medical Mondays as we move through this pandemic, we're going to be hosting Power of Prevention events, Power of Prevention conferences, Power of Prevention tours. We're going to be partnering with faith-based and other organizations in some states where health disparities, like in the Delta in Mississippi, where there really needs to be care. And we're going to be doing these things as we pursue funding, not only from elected leadership and organizations, but from corporate sponsors. So we have a strategy and a plan in place. We have all been together for more than a decade serving community. We champion Dr. O because of her heartfelt commission to go anywhere to ensure that people have access to quality health. And so what we're doing now is taking her heartfelt mission that we've all championed through Global Vision Foundation, and we are going to target communities and just continue to expand this. We have a silent goal that I don't mind sharing with you, but we want to have an international group of no less than 10,000 people. And we believe that we can do that if we just stay the course, and we can leave a legacy for health and for wellness for our communities. So we love young physicians. We love young professionals. We love anyone who is committed to quality health, because we truly believe strong health, strong future. Dr. O, do you want to add any other comments?
I just say amen. I am excited about Dr. Appiah. And thank you so much, Dr. V. I am, look, I'm not just excited, I'm ecstatic.
Yeah.
I give God the glory for you. And yes, we will navigate how we can, assist in putting you out there.
I want to thank Mr. Doherty for bringing the lights to our world here and bringing us to Dr. O and Miss Jones. So thank you, Mr.
Thank
Doherty.
you so much, sir. He's an angel. It's a gentle giant. sits quietly and makes things happen. That's Mr. Doherty.
Yeah.
And Dr.
Dr.
B
O and Ms. Jones, how do we contact you guys? Do you have a phone number? Because I also have this group
we'll drop it. We'll drop it in the chat.
Okay. I have this group that's doing amazing work that they partner with me to do free medical mission that I think you'll be a great asset to them and vice versa. They do free medical mission. They have a bunch of young medical doctors in Delta State, and we just give them money to buy medicine, free glasses and so on. And they use their time, weekends, Friday through Sunday, to just give free medical treatments, surgeries, everything on the spot. So I think they would be a great asset vice versa to you. So I'd like to connect the doctor in charge to you guys.
That is absolutely wonderful. It's just the vision that we have is to just make the connection and to unite and to collaborate. As many of you may know, the way that corporations and the way that organizations really like to donate is impact. And impact happens by not just the quality of what you do, but the numbers that you can touch. And so every opportunity that we have for partnership, in my former life, I served as chair of the Commission for Women in Prince George's County, Maryland, and was able to elevate. Global Vision Foundation was already doing amazing things, but to elevate them to elected leadership, to community, and give them the platform that they are recognized in the state of Maryland. And we are in the process of moving the work, beautiful work that Global Vision has been doing in the community to even higher heights. And so we welcome every opportunity for partnership. We are women's champions. We are community champions. We are advocates. Dr. O was just reminding us yesterday in a strategy meeting that she advocated for returning citizens and individuals who have been incarcerated to receive a higher level of quality care. So we are all not new in this work that we're doing. We're expanding the work. We're making room in this season in our lives to see if we can touch more, partner more, collaborate more, so that we can serve God ultimately in all that we do. So thank you so much. We are connected. I'm just dropping Dr. O's number in with mine, and you'll be able to reach us. I think just about everybody on this Zoom has our contact information. Text us. You have our email address as well to follow up with us. And I'll try to drop the YouTube link in. Before we go, Dr. O and Dr. Ajibade, if you're still here, I'd like to have both of you give some closing comments. Go right ahead.
But before I give that, Dr. Ajagbe is actually leaving for Nigeria to champion and to lead, a huge medical missions. Dr. Ajagbe, can you please unmute? Been trying to unmute you, sir.
Thank you, Dr. O.
Hello, everyone. Good evening.
Good evening.
It's better to listen many times, to be with fewer words. But thank you for acknowledging that I'm on.
Dr. Ajagbe, sir, I wanted to let Dr. Appiah know that you are a dental pathologist and the chief of Howard University for 21 years.
Oh, wow.
And has been in private practice. After that, I mean, Dr. Ajagbe has gone on medical missions with me several times. And I can tell you in 2018, this man averaged 200 tooth extractions a day. On Thursday, we started on a Saturday, May 19th, 2018. By Thursday, his hands were swollen. I didn't know, and he didn't say. He completed the mission on Friday before he showed me. He's an amazing man. You need to connect. You will learn a lot from him, and there are some cutting edge things in jaw expansion instead of braces.
Awesome.
All of those that he is expert at. You need to connect.
Oh,
But
very
I
nice.
got your wife's number. I'll connect you. But it's heading this huge.
Oh, that's really nice to know. Thank you so much.
You're welcome.
I have friends at Howard too, so in the oral surgery program, so it's good to know.
Yeah. Well, thank you for the introduction, Dr. O. This has been a very exciting program. I'm sure that sometimes we have digressions, but for most part, it's a lot of information that people live by. They learn a lot, and I'm very proud of what is going on Medical Monday. I had wanted to acknowledge one of my old classmates in high school, who is a professor of pediatrics. He's been joining from Nigeria almost every Monday since we started.
Wow.
But he quietly just stays there and doesn't say much.
I know.
He was the one that asked the question about the vitamin D toxicity. Anyway, so I wanted to acknowledge him, but he already went to sleep, after the first session.
Week, please? Can you do that next week?
Sure, I will. I actually put it in the chat box, to, welcome him and let him know that I recognize he was there.
Oh.
Also, I do observe that since we started, many of my old high school classmates have always been on. At least every week, there's at least 8 from Nigeria from my high school that have always been there. Many of them are doctors and many of them are pharmacists, and they still enjoy being part of the program.
Conversation.
Yeah, thank you, Dr. O, for saying something about the mission. The mission is a big one. Currently, we have about 91 volunteers in terms of medical doctors and other people, nurses, matrons that will be part of this. And this is a very big program that we're going to have in July. And I'm very delighted that, I'll be heading this, and it's going to be an exciting time that will bring in relief to those people who have been ignored or forgotten by the governmental systems.
Mm-hmm.
So that is the mission that we are going for. And this time around, we want to see how we can integrate allopathic medicine and naturopathic medicine to truly help the indigent people in the geographic area. Many of them already have some botanicals in their compound, and want to help them to see the value of those botanicals that they already have. They will be corrected. Some things will be used from here. Medicines from here allopathically will be available, as well as naturopathic remedies. So this is one of a kind. Many people haven't done this before, but we are trying to pioneer this approach so that it is sustainable and the people can truly take charge. Even though they don't have a lot of money, but at least they can take charge of their health and continue to live strong. Thank you very much. I'm always available. I'm always on the forum, every Monday. Even when I keep quiet, doesn't mean I'm not listening. The last thing I will say is that I already put a link for nutritional supplements. If you don't know where to get a high quality nutritional supplement, I posted it about 2 or 3 times in the chat, and I may post it again if somebody needs to see that. So you can go online and read around all these things that are there. and then you can, get in touch with me if you still need additional explanation. Thank you very much.
Thank you, sir. The mission we did in 2018, we saw 7,316 people in 1 week.
Whoa.
I don't know how it happened, except God. It was a blessing. So I'm excited about this mission Dr. Ajagbe is going to, with over 90 medical personnel. I know that they're just going to bless so many people.
That's so beautiful.
Thank you so much. Thank you so much, Dr. O. Madam Laura, do you want to comment? I see your raised hand, and then I have a couple of questions.
Yes, I do.
Yes.
Dr. O, you are phenomenal. You've been generous with all of this information and resources. But you, Dr. Jennifer, you come every Monday with this rambunctious spirit. You haven't tell us what vitamin is responsible for that. We want the secret.
Vitamin Jesus.
Vitamin G, exactly. Vitamin G-O-T. It is truly God. Thank you so much, Madam Laura. And I'm so excited, Madam Laura, just for what you continue to do to support us every week. We look forward to you, and we don't hear you, but we see you logged in. We feel like, oh, right, because we know that someone who has our back. So I can't wait to come to California. I shared with you before that I have a large clan there in the Los Angeles area, and so I look forward to us breaking bread one day. But for now, I'm overjoyed. Every time I see your name, I feel like we're doing the right thing. You and Dr. Ajagbe. So thank you so much. And Dr. Ajagbe, I'm so pleased, proud, and excited to see you and what you're going to be doing. Again, I remember Dr. O telling us about the 2018 experience. So I have 3 questions and hope that my questions don't offend you. The first is a simple one. Are you going to try to do vaccination when you're in on this medical mission?
Wow. Good question.
Do you mean assisting in giving vaccination to the indigents of Nigeria?
COVID-19 vaccine.
COVID-19 vaccine.
Yeah, I understand. I don't, presently, I don't have access to that information. But I can tell you one of the organizations partnering with us is actually headed by somebody who is part of the presidential task force on dealing with COVID-19 in Nigeria. Definitely, we are going to do the precautionary part on our side, but when we get there, we will find out if they need help. If they need help in that community with vaccination, then we will, provide such services. But we actually already have PPE, N95 face mask, face shields, all the things, gloves and sanitizers. All of these were actually provided for us by the Nigerian government. So that's to show that they are in support of this mission. We're expecting it to be real big. 2 teaching hospitals are also partnering with us. The Bowen University Teaching Hospital and Lautech Teaching Hospital, they are on board. We have 48 volunteers from those 2 institutions alone. So that's a lot of effort. So if when I get there and they find, and I find out that the vaccination, program needs a little bit of help, that was something that we'll be willing to participate in. Yes.
So before you go, Dr. Ajagbe, I'd like for Dr. O, you and I to have a conversation. Every Tuesday night at 7 o'clock, I meet with the Health Equity Policy Group. We work directly with Dr. Nunez-Smith on the Biden-Harris task force. We have a direct line of communication with her to pick up the phone tonight even. So I would love, before you leave, if you could just, what I want to do is just have a simple letter and email from you about what you're doing and get it to her to find out if she can expedite and assist with the boots on the ground there where you're going.
Well, thank you very much for that opportunity. If you send me the information, I'll respond to that.
Absolutely.
I will be leaving on the 1st of July. So I think we have only one more Tuesdays.
No. I can talk to Dr. Nunez Smith anytime.
Well, I thought you said
no,
every
we have
Tuesday.
The meeting is tomorrow night. So I want to bring it up on the meeting tomorrow night for the full group, but I'm going to send a text to her EA as soon as we get off this call.
Okay, that's fantastic. Well, thank you very much for that.
Absolutely.
I'm sure everything will help. Anything that can help, we'll be glad to use. And in fact, you won't believe, just last night, I got another call from another institute that is doing multicultural health. And they are excited about this mission that I'm going for. And they are actually wishing to ship some glucometers and all the little things that we need as part of their contribution to the mission. Everybody seems to be excited once they hear about the mission. Thank you very much for that offering.
It's absolutely beautiful. And I know that you have all of your affairs in order for going, but is there a way for those of us who wish to contribute to your mission?
Yeah, I mean, I can post a link, to the donation site, through PayPal or Zelle or, or cash application. I'll be glad to put that information there, right?
That's perfect. Thank you so much, Dr. Ajibade. Thank you, Dr. O.
Dr. Ajibade, I'm very grateful that you mentioned about teas while you were making your initial presentation. So I didn't realize you knew so much dentistry. Is it still on?
Yes, it is.
Dr. Ajibade, are you still there?
I don't think so.
I think he might have hung up.
Yeah.
He's actually giving another talk. So
I was just about to say he's still with us, but I think he had another obligation.
Presentation. Yeah. Okay.
Yes.
Well, it's been a wonderful evening. Thank you, as usual.
Thank you so much. Does anyone else have any comments before Dr. O closes us out and we close our evening as we always do?
I just want to say this was worth my time, and I am so grateful. Thank you so much.
Thank you. Thank you for coming.
Thank you, Dr. V. Thank you, Dr. V.
Yes. Thank you so much. Thank you, everybody. Thank you, Dr. Ajibade, for all you do. And I'm so excited about Dr. Appiah. I am so excited.
Me too.
Sky is not your limit. And it's up to us, all of us.
Yes.
To team with you and just keep lifting you up. So I'm excited about you. And we'll be looking forward to your presentation here on Medical Monday.
I hope you exchange information. I guess we can always, okay, great. Thank you.
We did. Thank you so much for the introduction. And I'm glad I could connect with you, Dr. O, and the others on this platform. Yes.
Dr. Jones, thank you for what you're doing. Dr. Ajibade, we appreciate you. There's a lot of work to be done. You guys are just doing something that's close to the heart. Thank you.
Yes.
You're very welcome.
On the program, we go for 45 minutes because of YouTube, and then we do a hard stop. So I think that was what confused Dr. Appiah, that she left. I was putting it in the chat box that don't leave. We do a hard stop, but we continue. And what we found out is that after our that we thought would be just, something you click on to continue the program if you choose to. It's actually now linked together. So it doesn't matter. The whole program is linked together. And today, God is wonderful. I love the way that God chooses to do what he wants to do regardless of us. Because we don't usually have an after hour like this. Usually we continue with questions. Yeah, we appreciate and recognize people, but this has been really, really a blessing. And that's what Medical Mondays is about. It is not, something hard and written in stone. We allow the Lord to lead us in what he chooses. And this is where he led us tonight. And I am excited. And I just want to add that we still should remember that coronavirus 19 is still very much around. And we should not be careless. I believe in physical distancing, not social distancing. We love to socialize. That doctor there, Dr. Jones, don't mind her. In the heat of COVID, we were so tired of not seeing each other. Guess what? She and Dr. Caprice came together and said, look, show up in DC. We're going to have brunch that turned to who knows what. And we did. We showed up. We had a fantastic time. That wasn't enough. We've done it several times, even in the heat of COVID. So don't mind her. We socialize. It's the physical distancing that we need to do, especially when you don't know somebody, you don't know their status, you don't know if they've had coronavirus or gotten the vaccine. If somebody had contracted the coronavirus, they have antibodies. I am doing a small research in my setting, and actually I've found I'm surprised nobody asked about the super antibody in people who have contracted coronavirus. Like 5% of people who have contracted coronavirus actually have this super antibodies that diluted 10,000 times, it still kills coronavirus. And they may be the solution, the answer to COVID-19.
Yes.
Research is still being done on in that aspect. And another thing, I am surprised these questions were not asked. I left it for question time. Pregnant women are now, taking the vaccine, and children, they've rolled it down to 16-year-old, and they're looking to, take it down a little bit further. Research is going on that, and stay tuned because we'll be updating you on COVID-19. Meanwhile, let's stay safe and let's stay strong. Good health. Come on, somebody finish.
Question very quick. So just like you mentioned, your husband, UAE, they do, make sure that the antibodies are really built or mounted properly.
Yes.
We don't do it here.
No, we don't.
Just in case someone, excuse me to say, is wise in his own sense and want to make sure he's doing that, or maybe somebody not in that direction, but got out of himself, say, let me do it and make sure I'm totally okay. It does like 3 times, 4 times, 5 times. What would that be? Is there a study to show that more of those will not be good, or what? I'm just saying. So if there's a study going on, we are alerted right away.
I don't know.
Good health, good future.
Sorry?
Someone answered your request.
Thank you. Strong health, strong future. Thank you. So,
you're welcome.
Thank you, sir. Anthony Okusanya came back. I was, appreciating him, trying to unmute him, but then, he didn't. Welcome back, sir. He's all the way from California. He's driving. That's why I think he hit a dead spot. I'm unmuting you, sir.
I'm going to go back on mute again. Thank you. I'm driving. Yes.
Okay, sir. Okay.
Great job. Great job. I love it. I was here throughout. I didn't leave.
I know. I saw you.
Maybe I transitioned from my iPad to my iPhone. So, but anyway, I'm here. Great job.
Stay safe. So, Ephraim, we don't know if there's a research like that going on, but in the chat box, somebody asked if somebody like that who has super antibodies don't require vaccination. I can guarantee you that they will not vaccinate people like that for now. Because they have super antibodies, they have protection. If you dilute their serum, their blood, 10,000 times, it's still killing COVID. So they don't need vaccine because that's what vaccine is intended to do, to create that antibody that will protect against COVID.
Thank you.
Oh,
There's a study on that going on in Virginia.
may I ask a question?
Yes, go ahead.
Absolutely.
So I was one that talked about not requiring vaccination.
Yeah.
My daughter caught COVID when she went to Nigeria. She's been back. She's been vaccinated. She got the first dose. So no one is asking whether you had it before. Those questions are not asked. Is there a risk?
No, there's no risk. So if you have coronavirus, you can still get the vaccine. In fact, CDC is encouraging that you get it. But if you just got the virus, they're recommending that you don't get the vaccine right away. There's a wait period. I believe it's like 3 weeks at least that you need to wait before you get the vaccine. But
she had the virus, I think almost 2 or 3 months ago when she went. She waited. She didn't go to the hospital. She got cured. She tested positive, negative. And recently we all went to take the vaccine. Nobody asked if she had contacted it before.
And that is okay. It's totally safe. In fact, like I said, this is recommending that you actually get the vaccine regardless of if you have gotten COVID as infection. I was talking, and I thought you were alluding to those with the super antibodies. They are undergoing research on those. They will not vaccinate them. They don't need the vaccination. That's a different category.
Thank you. I found it. Thanks.
You're welcome. Over to you, Dr. Jones.
If there are no more questions for this evening, we are going to say thank you to every
there's a question. There's a
yes.
question. Somebody is asking what the date is for the medical mission.
Oh, thank you. I missed it. I was downloading the PayPal link.
It's July, July 12th to the 16th. 2021, July 12 to 16, 2021.
And you leave on next Thursday, July 1st, right?
Yes, July 1st, yes.
Mm-hmm. Okay. Wonderful.
Thank you.
Thank you for all that you do, Dr. Ajibade. And we also see the link that you provided to Live Pure nutritional supplements.
Yes.
Sorry, sir.
Yes.
For those who are saying that they don't know where to get certain nutritional supplements from, I want them to explore the website and see, and just learn for themselves and see whether what they have there is they are applicable to what they want. So, but I know that they are very good. I use them. I use the nutritional supplements from that manufacturer.
Somebody's talking. Okay, Mr.
Yes.
Adewale, go ahead.
Okay. Thank you very much, Ma and SARS, for this opportunity. And I must confess that this program has given me a lot of enlightenment as far as the issue of health is concerned generally. I appreciate what you are doing, and I'm grateful for that. Please, I would like to, I'm passionate about the medical mission coming to Nigeria. And then I know we have quite a number of doctors already participating. So I would like to know possibility of being part of it, volunteering for. So that's why I'm asking the question of the dates, so that I can arrange to make myself available at that time. I'm at the UOHC, very close to where most likely, in addition to the institutions that are volunteering for the program.
Dr. Ajibade?
Fantastic. Thank you so much.
Yeah, thank you for the for volunteering. I think you need to reach out to me. We need to exchange information so I can give you all the details about the mission. Would that be possible? Can you just type your phone number on in the chat?
Well, you can private chat me. Can you private chat Dr. Ajibade? Or if you want to put it on the forum, or private chat me, either.
Yeah.
Or I can private chat you. Should I private chat you with my number?
And then that way it'll bring it back.
Yeah, that's fine. At least he will get the information he needs.
Yeah. Oh, I'm just going to connect both of you as usual.
Yeah, that's fine. Thank you. Thank you for volunteering.
I private chatted you my phone number. It's my WhatsApp number also, and my regular number either. Is that good? Did you get it?
He probably muted himself already.
Yeah, he did. To God be the glory. To God be the glory.
Thank you.
Did you get it?
Yes, thank you.
Wonderful. So chat me. I'm on WhatsApp. You could do regular text and I'll connect you.
Oh, all right. All right.
Thank you so much. Wow.
Awesome. Look at God.
Awesome.
This has been such an amazing and beautiful moment and show and hour. Thank you, Dr. O. Thank you, Dr. Ajibade. Thank you so much, Dr. Ajagwe. Thank you, Dr. Veronica, to your amazing daughter and son-in-law, and to all of our Medical Mondays VIP winners, to Hannah and Ephraim for your support and just unconditional love and presence for us, and to every single Medical Mondays guest. Thank you to all of our dads who had a celebration for Father's Day yesterday. Congratulations and God bless you in all that you do as dads. You're so important to the lives of our children and our families and our communities being strong. So thank you, thank you, thank you. Dr. O, any other comments before we sign off?
I just want to say thank you, and please wait for smile. Let's smile. I'm dancing already. I'm ready.